Welcome, everyone. How are you? And thank you for joining us today. This is my first Facebook live town hall meeting. I have a guest with us today. He's Dr. Fred Browne. He's the Chief Medical Officer and Infectious Disease Specialist at Griffin Hospital. These recent weeks have been the most challenging the most of us have ever seen. While we cannot meet in person like we regularly do through the district, I'm happy to be holding this meeting via Facebook Live. Thank you for taking the time to join us today, and feel free to ask questions in the comments section during the meeting. Now, if for some reason you don't get, we don't get to everyone's questions, please email your question, and when the meeting is over, email it to me at george.logan@cga.ct.gov, and I'll be sure to email you back with an answer. Now, before we get going with Dr. Browne, I want to just go over just a few statistics, a little bit of information that I have. As of the beginning of today, the state of Connecticut, continues to take actions in response to the global spread of COVID-19. Governor Ned Lamont provided the following updates. Now, this is as of the end of the day yesterday. So when we take a look at the confirmed COVID-19 cases, statewide, 22,469. COVID-19 associated deaths, 1,544. Patients currently hospitalized with COVID-19, 1,972. And patients tested for COVID-19, 69,918. So at this point in time, I would like to take the liberty of all of us just taking a moment, a short moment of silence for those who have succumbed to COVID-19, for those who are currently being treated for COVID-19. And let's just do that just for a few seconds, if you don't mind. Thank you. Also, I'd like to take this time also to thank all of our first responders that are out there, our police, firemen out there, firefighters, all the emergency, the EMS folks that are out there. Also need to thank those folks, our grocery workers that are out there, folks on the front line, our healthcare workers, folks that are out there, and other essential employees that are out there every day working, trying to keep us safe, trying to treat those those in need. So definitely want to make sure I give a big thank you to all of those folks. Now, when I take a look at our county, New Haven County, in terms of the confirmed cases in New Haven County, we have 5,811 confirmed cases in New Haven County. Looking at a neighboring county, Fairfield County, that's compared to their 9,883. And we've got over 620 people in New Haven County that are currently hospitalized as of the end of the day yesterday, compared to Fairfield County with 749. So this is a very serious situation. We are certainly hopeful that there'll be a bit of a flattening of the curve in terms of the number of additional folks that are hospitalized, that need treatment. But if you're looking for more information, there are several additional graphs and tables containing more data, including a list of causes in every municipality, right? So I represent the 17th Senatorial District, which represents Ansonia, Derby, Bethany, Beacon Falls, Naugatuck, Woodbridge, and Hamden. But this information today applies to everyone. And hopefully you'll find this helpful, regardless of where you live in the state of Connecticut. But you can also go to the state website, www.ct.gov/coronavirus.com, to get more direct information. Or you can also go to my website at www.senatorgeorgelogan.com. You can also sign up for my email e-blast as well for more information. So when we take a look, throughout this crisis, there are lots of issues at hand here that we're dealing with. For example, in the business community, I'm hearing a lot from folks in terms of folks are worried about being able to keep their employees. Employees are worried about their jobs. Folks are worried about basic essentials like food and paying the rent and that sort of thing. I just want to make sure that folks understand that there is federal assistance out there. Just today, this is breaking news for today. Today is April 23rd. The House has just approved $480 billion, $480 billion package to help small businesses and hospitals. Dr. Brown, you like that one, and help hospitals, and to expand COVID-19 testing. And now, so it also passed the Senate down in Washington, right? And so it now goes to the president's desk for signing. So that is certainly a ray of hope. There are federal programs out there, including the PPP program, which is the Payment Protection Program. And there's nearly $350 billion of funding in that program. There's also the Small Business Administration loans. There's the Emergency Economic Injury Grants. There's the refundable tax credits. There's employee retention credit. There's disaster loans that are out there. And I would recommend to folks that if you have an interest in looking up what the Small Business Association federal program has, you can go to www.sba.gov/disaster for more information there. I do hear a lot here in Connecticut. Folks are concerned about tax filings, right? So many of you, most of you probably already know that the Connecticut Department of Revenue Services is extending the filing and payment deadline for personal income taxes returns for 90 days, right, to July 15th. And also there's an extension on the federal government as well. There's also a state business response unit. Small businesses seeking guidance can reach the unit by calling 860-500-2333. Also, there are reimbursements for COVID-19 medical leave costs. Again, another federal program announced, the IR-2020-57, that small and mid-sized employers can begin taking advantage of 2 refundable payroll tax credits designed to immediately and fully reimburse them dollar for dollar for the cost of providing coronavirus-related leave to their employees. Also, unemployment is another really big area. Many folks have sent me text messages, emails, called me, stopped me in the street, in the supermarkets, and questioning unemployment. There seems to be a delay, concern. Well, the Connecticut Department of Labor has now processed, now get these numbers, 327,000 of the 402,000 applications in Connecticut. I heard that that number represents, in the matter of a month, almost 2 years worth on normal times of unemployment requests. So, they're working hard. In the past 5 weeks, the agency, Department of Labor, has now provided $230 million in unemployment benefits. The agency is on target for reducing the processing time of claim applications from 6 weeks to 1 week by April 27th. So that's what they're telling us. So we're going to keep our eye out and hold them to that. The state is developing new systems to accommodate the 3 federal stimulus programs for unemployment insurance. This includes programming for federal pandemic unemployment compensation, FPUC, that will allow the agency to add the additional $600 to weekly state benefit payments, and pandemic unemployment assistance that provides benefits for self-employed individuals. That's another big one. There are a lot of self-employed individuals out there that previously were not eligible for unemployment, and now they will be. Now, this FPUC is scheduled to begin the week of April 27th, and the agency expects to begin accepting applications for PUA by April 30th. Now, this is key, with both programs to be retroactive. So please, if you're a sole proprietor, you have a business, please do your best to try to get out there and take advantage of that. And that's it, in addition to other federal stimulus packages, such as the CARES Act, that is out there. I would also like to take this time to talk about, and again, I'm trying to provide information that's helpful to folks out there. And one thing that I'm hearing from a lot of folks are worried. There are a lot of scams out there. So be aware of scams. Predatory solicitations will seek your personal information, claiming it is needed for your eligibility to receive federal stimulus checks, or that the group is relates to the 2020 census or a fake charitable organization. Please be on the lookout for fraudulent emails, fraudulent text messages, fraudulent phone calls, and fraudulent social media posts. Also, the FDA and the FTC confirmed that there are no, I repeat, there are no home test kits or any recommended vaccines, drugs, or investigational products currently available to treat or prevent the virus available to the general public. So if someone calls you offering these things and asking for money, especially to do that, it is most likely a scam. Tips to avoiding coronavirus phishing scams. Don't click on links from sources you don't know. They could download viruses, computer viruses, onto your computer or your smartphone or your device. Watch out for emails claiming to be from the Centers for Disease Control and Prevention. This is actually happening. Or experts saying that they have information about the virus. For the most up-to-date information about coronavirus, visit the actual Federal Centers for Disease Control and Prevention, the CDC, and the World Health Organization online. You can Google that. Ignore online offers for vaccinations. There currently are no vaccines, pills, potions, lotions, lozenges, or other prescription or over-the-counter products available that can be mailed to you to treat or cure coronavirus disease online or in stores. Do your homework when it comes to donations. There are a lot of nonprofit organizations, a lot of organizations that are seeking donations, right? Even some monetary. However, whether it's through charities or crowdfunding sites, don't let anyone rush you into making a donation. If they're rushing you into making a donation, it's probably a scam. If someone wants donations in cash, by gift card, or by wiring money, don't do it. Verify a charity's authenticity before making donations. Avoid clicking on links in unsolicited emails, and be wary of email attachments. Use only trusted sources such as legitimate government websites for up-to-date, fact-based information about COVID-19. So again, for up-to-date information, you can always go to my website, www.senatorgeorgelogan.com. You can also go to the state website, www.connecticut.gov as well. And again, thank you all for taking the time and coming on board here. Looking forward to hopefully providing you with some useful information. We have, again, Dr. Fred Browne from Griffin Hospital, and he is now going to provide us with a very informative and very useful presentation. Again, thank you, Dr. Browne, for joining us.
Thank you very much, Senator. I really appreciate it. Thank you for inviting me, and honestly, thank you for everything that you're doing for the community. We really appreciate it. So I'm glad you're out there and listening to everybody and sort of helping us sort of help the community. So this is great. What I wanted to do today was I wanted to spend a little bit of time in educating the community on what we're dealing with. What is coronavirus? What is this whole thing that's called COVID-19, and talk a little bit about that and just sort of explain it. A little bit about my background. So I'm an infectious disease doctor. I'm also the chief medical officer and vice president of medical affairs at Griffin Hospital, where I spend all of my time. I'm trained as an infectious disease doctor, but also I've actually been trained in managing pandemics like this. So I am actually trained in a specialty of hospital epidemiology. So I actually have quite a bit of experience in this. So this has sort of been my niche when I did my fellowship training, and have an interest in this type of illness and what actually happens. So what I wanted to do is maybe spend another 15 minutes just basically talking about the virus, explaining what it is, what it does, where it came from, and really going from there. So let's start off and talk a little bit about the hype that was out there. And a lot of the information that can be misinformation. And this slide kind of gives you that idea that early on in this virus, 38% of beer drinkers wouldn't buy Corona because they're afraid of getting it. A little bit of fake news out there, but ultimately I think is a point. And then immediately after that, all of a sudden, all the toilet paper. So this is my local ShopRite. All the toilet paper disappeared. So no one was buying beer, and all of a sudden all the toilet paper was gone. So a lot of hype and concern. But what we're going to do now is we're going to talk a little bit about this virus, sort of ease a little bit of the concern about it, and just sort of let you know what we've been seeing and what we're doing here at Griffin Hospital. So coronavirus is actually a really common virus. In regular season, usually a winter season, about 1 to 5% of the population gets infected with coronavirus. So it's actually not new to humans, at least not the coronavirus as the big family. And it can be as common as 40% of the population can get it if they have a chronic illness known as chronic obstructive pulmonary disease, and it can cause an exacerbation. So it is a virus that typically occurs in humans. It is more common in animals. In particular, it's seen as a diarrheal illness in a lot of different animals. It's known as the coronavirus because when you look at it under a electron microscope, so you get to see small right down to the particle itself, it actually has this crown around it, or looks like a crown, and that's how it was named the coronavirus. The difference with this coronavirus versus that 5% coronavirus that I was talking about is that this virus is a special type of virus. So when we talk about coronaviruses, we're talking about a big family. Just like we would say Homo sapiens. Homo sapiens is humans, but if you think about it, there's so many different humans. And that's the same case when we talk about viruses. And in particular, we're talking about this family called coronavirus, and it has two subsets associated with it. One subset is an alpha coronavirus. That's the typical infection that we get. The other one's called a beta coronavirus. And the beta coronavirus has occurred in the humans in the past. It's actually happened 3 times, and this is the 3rd time. The first time was called SARS, now probably called SARS-1. It occurred in early 2000. It caused a pretty significant infection, was focused around the area in Canada. And then a second one occurred probably around 2010, 2012. It was called MERS-CoV. So MERS-CoV is also a coronavirus in this beta coronavirus family. And now we're currently seeing this COVID-19 or SARS-2. For some confusion that's out there, sometimes you'll hear scientists call this SARS-2. SARS-2 is the name of the virus itself, and COVID-19 is actually the syndrome. So it's the illness that occurs with it. So what I wanted to do is talk to you about where this came from and why is this so unique from anything else that we've had. And to explain that, we really need to talk a little bit about where it came from. So this virus, was sort of floating out there, and it was probably in bats. And bats are very common carriers of coronavirus. They just have a tendency to carry coronavirus, but don't really get sick from it. Now, that's usually fine if they're in nature. They float around, and I said this is typically a GI illness, so it gets in the GI tract. The bats can defecate, and then another animal can get exposed to that, and then they can potentially pick up the virus. Now, if we're in nature, that doesn't occur very often. However, what appears to occur was that virus was in a small area in China called Wuhan City. And Wuhan City had a little market, had a little seafood market. And in that seafood market, there were several different animals that were there, very tightly packed. And those animals being tightly packed, and some of them were exotic animals. So these animals that were tightly packed, bats were probably associated with this also. What sometimes happens is you put all these animals together who normally aren't together in nature, you put them together, and if they get contaminated with this virus, then they can potentially get sick. As I mentioned, they usually have a GI tract illness when they get sick, and that can spread from one animal to another animal to another animal. And then the biggest animal of all that's really densely packed in that area is the humans. So what initially occurred in Wuhan City, probably in fall of 2019, is all of a sudden there were patients that started to get sick. So people are starting to get sick who are associated with this market. And the term that we use, we have a special term for that when people get sick from animals, we call that a zoonotic infection. So just like the word zoo, right? You think of a zoo of where a lot of animals are kept. So zoonotic is transferring from an animal to a human. So we knew about this zoonotic, and people were getting pretty sick from this in this area in China. It really became extremely important towards the end of the fall into the winter. So around December, the end of December, all of a sudden we were noticing that people were getting sick away from this market. And at that point, we were concerned about this spillover effect, where one human, so it was animal to human, and then all of a sudden it was human to human. This becomes really important and why this is spread out. So if something is typically in an animal and then it spills over to a human, that means it's never been a human virus. That means we as humans have never had any antibodies to fight this. And if we don't have any antibodies to fight this, then we don't have antibodies to fight this. We get sick. So depending on how infectious this is, we can get really sick. And this is how this virus started spreading around. So let me talk to you about the possible animals that were associated with this. So this is the horseshoe bat over to your left. This is our little guy, wanted, because it carries a lot of the virus around. So this little bat probably ended up transmitting the virus to this other little animal, which is called a pangolin. So this little pangolin all the way to the right is an anteater, which is usually in India, but has also been found to be in China. And it's been used as Chinese medicine, as food. Its scales are used for other industry. It is a protected animal, but sometimes people don't always do the right thing. And unfortunately, this animal was associated with this virus. In fact, scientists took some of a virus that was identified in this animal and compared it to the same virus that's infecting humans now, and they found that it was about 96% match between the two. So they looked at the genetic code of the virus that was infecting this little pangolin and the genetic code of the virus that was affecting humans, and they matched them. It was about 96%. Now they think that this is probably one of the animals that spread it to humans, but we're still continuing to look at that. And I know there's a lot more smart scientists that are out there sort of putting that together to get us a final answer of where this actually came from. So let's talk about the clinical syndrome. And you've been hearing a lot about this. And as a virus spreads out to a lot of different people, there are variations of it. But the commonality is that the symptoms after you get exposed, you usually get symptoms 2 to 14 days with an average about 5 days. So if there's an exposure, then in that exposure period, it's about 5 days that you end up getting unwell. So that's really important. If you think about it, because we're talking about isolation periods of time, an isolation period is about 14 days. That's because this infection, once you get some exposure, it can occur in up to 14 days. After 14 days, if you don't have it, you're pretty much not going to have it. And anything even before that. So if you don't have it after 5 days, the likelihood that you're going to get it becomes lower and lower as you get to that 14-day mark. If you do get sick, then typical symptoms, and again, there's a lot of variations of this, but the typical symptoms are fever, cough, shortness of breath. There's also associated other things like body aches. There's a lack of smell, lack of taste. Usually those are associated with bigger symptoms, but the most common symptoms are body aches, fever, cough, very similar to the flu. If it gets really bad, then things can worsen and you can get fatigue, fever, you can have decreased kidney function, you can get diarrhea, you can get sore throat, you can get shortness of breath, your white count can go down. And then there's something that really bad can happen. We call that the cytokine storm, in which your body is trying to fight off this virus and throwing everything at it. And it ends up throwing almost too much at it. And it makes people really sick. And that potentially leads to people being on the ventilator, and sometimes it even leads to death. That's the bad thing. Let me give you the idea, give you really what's happening and try to get away from sort of that 5%. So if we look at the data that's currently out, if we look at all the data that we're looking at, from the Chinese data, from the data in Singapore, from even the West Coast data, it's looking that 81%, 82% are completely mild infections. 81% are completely mild. And even that being said, 95%, so those who actually even get a little sicker and need to be in the hospital. So anyone who's past that 81%, those who get a little bit sicker, we're talking about people who need to come in and get admitted to the hospital. 95% of the people who get infected completely recover without any issues. Now, 5% can end up going into the intensive care unit, and 1% of those can be put on the ventilator and can even die. And of those who actually die, this is sort of a little breakdown of what we see. And this is sort of explains why we're doing certain things in certain populations. The biggest concern that we have in the highest risk patients are those who have chronic pre-existing illness and are older than 65. In particular, the older you get, which is the single most highest risk factor, is your age. So if you're greater than 80, there's up to a 15% mortality associated with that. So that means if you're 80 or above, you get this infection, there's a 15% chance that you can die from this. And this is sort of what we've been seeing. Now, people ask me this a lot. They ask me, well, what's the difference between this and influenza? The first thing that I say is it has to do with time. So as I mentioned before, this virus is the first time that we've seen it as humans. So because this is the first time we've seen it, that means it's actually spreading very rapidly. So in a typical year, an influenza season lasts from anywhere from 4 to 6 months in a certain region. 4 to 6 months. So you have 4 to 6 months of this, and and we have vaccines also associated with it. So 4 to 6 months. But on a moderate influenza season, if you look all the way down and all the way to the left, there can be 48,000 people who die in a moderate influenza system. 48,000. That's with a vaccine, 48,000. But it's not as noticeable because it's 4 to 6 months. So you don't really see it. You see this, and you've probably heard of this in the moose too, this widening of the curve. So it's occurring, but it's occurring throughout a period of time. There's not a big spike that you potentially see. COVID-19, and we also look like this is going to be moderate throughout the US. So if you look at that, you look at it moderate, it's going to be about, it looks like 80,000 people can potentially die, which is still a lot of people. The big difference that you notice with this is that this is a sharp curve. So this is occurring very rapidly. So imagine that 4 to 6 months being compacted down into a single month, right? Because these things are passing by within 4 weeks. They're sort of in there. In New York City, it just went like rampage. It just continued to move forward. And that's why what you're seeing. And that's the big difference between the two, between flu and COVID-19. Again, COVID-19, there is no vaccine as of yet. Well, how do we know about this? So this is a big thing, diagnosis. And I'm going to spend a couple slides just talking about diagnosis and what we're doing at Griffin Hospital. So right now there's 3 major tests that are out there for diagnosis. The 3 major tests are PCR test. So that's actually a test, and this is ours all the way to the right. This is what we have at Griffin Hospital. So the PCR test is a 45-minute test, and it takes the genetic code of the COVID-19, which we already have on file. So we have that genetic code, and we compare it to your genetic code if you're sick, and we put that together and we see if that actually matches. If it matches, then you're positive. And that takes about 45 minutes. I got another slide to explain that a little bit more. There's a molecular test. So basically what the molecular test is, it says, okay, there's X, Y, and Z things that are involved with this molecule called the COVID-19, right? This coronavirus. So we know that we're going to get this. So we're going to compare that to what we know is always associated with this virus. And we put those two together, it's a pretty quick test. So that takes about 5 minutes to put together. The third one, which is a really important one, is a serologic test. And I'm going to try to explain that a little bit more. But what that says is it actually asks a different question than the other two. The other 2 tests, and all tests sort of ask a question. The question that the other 2 tests are saying, do you have the virus? This test says, did you have the virus? And that's what's really important, because then it can help us later on when people need to go back to work to know if they've actually been exposed to the virus and have now developed antibodies, which looks like they could be essentially immune if they have antibodies. So just a couple slides to explain sort of what we're talking about. So the first one, the PCR, just to let you know what kind of world we live in. We live in this amazing world that's done a lot of things in medicine and science. So what we do is we look at this genetic code, this RNA molecule, this small piece of genetic code in this tiny virus. We can actually identify that. We can actually put it in this machine. We can amplify it, and we can compare one genetic code versus the other, and then say if they're there, if there's all these copies that are there, then it's positive. Right? And that's why it takes 45 minutes to do. I can tell you when I was in training, it took a lot longer, but it's great that we have this technology that'll give an idea. And 45 minutes will give us what we have. The other thing is to take a patient's sample. In this case, it would be a swab, and then we can compare it. We can either look at the a portion of the genetic code, or we can look a portion of the protein and compare that in certain maps and say, does this map match this map? If it does, and all these come together, then this is in fact an infection, or you're infected with the virus that causes COVID-19. The third one, which is a little bit more complex, and there's a nice little graph that's here, this explains a little bit about what we're talking about when we're talking about your immune response. So this is your body, how it responds to viruses. The first thing it does, it actually gets to a period where it's incubating. You start getting some sort of symptoms. As you start getting some symptoms, your body starts responding to that. That means as you're getting symptoms, that means you have virus that's present. And as the virus becomes present, you end up getting a response to that. That very first response, which can be 3 to 5 days right away, is this IgM response. So this is an immune response, right? Those IgM molecules then talk to another molecule called an IgG molecule, and that starts to spike up. We can detect both of those. What that means is that when you have an IgG, that means that you are developing immunity to this. And IgG is also really important when you've been infected or when you've actually received a vaccine, because it helps protect you. And then when you get reinfected, that IgM comes back, you have a huge response to your IgG, and it eliminates the virus completely. And this is why we say once you get the infection, you're essentially immune. We do this through a little test, a little small test, much like we use sort of different complex methods, but one of the simpler tests is using something like a pregnancy test. We take a little bit of sample, we have some antibodies that are on it, and then once they get to a line, they flag it up and they give us a positive or negative. It really is that simple, and it takes 5 to 15 minutes to get a response. So what's the treatment and prevention? Well, you have heard a lot about the prevention. Prevention in my world is really about hand hygiene. Hand hygiene is really important. Masks become really important because you want to make sure that you wear a mask so you're not spreading the virus. You can spread the virus in 2 ways. This is really what's called a droplet virus. So the droplets that come out of your mouth and nose are really what's infectious. So if you get those droplets on someone else, if you get them into the face, the nose, the mouth, then that other person could potentially get sick from those virons. The other way, which is really important, is that if you cough or sneeze or whatever, and it contaminates a surface, that's also really important. So if you touch a surface and then touch your face, your nose, your mouth, your face, that's when you can actually carry that virus and put it up there. That's really important. So wearing a mask is great. So it protects you if someone potentially sneezes or cough on you. It also stops if both people are wearing masks, it stops both of you from getting things contaminated. And that's even more important, not to get contaminated. This is why you hear us say a lot about wearing the mask. And then you hear a lot of us say, this is why it's really important to wash your hands. If you touch a surface and then touch your hands to your face, then, which we do a lot during the day, then you're very likely going to spread this infection. If you touch a surface and then wash your hands, guess what? You're not spreading it anymore. It goes away. And this virus can go away pretty easily. Soap and water, alcohol-based hand rubs, even if you're not visually there, even UV light seems to work. So good sunlight on an area can actually eliminate this virus. So again, being really important. So you hear about covering your cough, keeping spatial separation, keeping that 3 to 6 feet away. Those are really important for infection control. When we talk about treatment, we're talking about different things. So one of the most important things is vaccines. And as I mentioned, we live in a world that's great. I mean, our technology is fantastic. So if we talk about it, we've already developed a vaccine. The reason why the vaccine isn't available is the vaccine needs to be tested to make sure it's safe. So we do not want to be giving a vaccine to people who we haven't tested it yet. So right now, the vaccines that have been developed are in clinical trials to give to have been done to animals. So it looks like it's safe. It's now human volunteers are currently getting it to make sure it's safe. And then once it gets to that point where we're comfortable getting it safe, and then we can manufacture it safely, then we can start to get it to us, to every one of us. And this is going to be a way that we can protect people without them getting the virus themselves. So that's about, and that's probably about 12 months before we can really get out there and use it and offer it to everybody. When we talk about treatment is really supportive. So you need to do things like you would for the flu. You know what? If chicken soup was great for you for the flu, do that for COVID-19. Anything that makes you feel better, gets you in the right state of mind, that's what's really important for COVID-19. Tylenol, Advil, anything along those lines are all very good to use. So anything that makes you feel better in that aspect, then that's what you want to do. For patients who get very ill, there are three things that we are using that appear to be working well. One is a medication called remdesivir. Remdesivir is a new drug. It's getting into phase 3, so we can get it. It's a little hard to get, and we've been using it, and it looks like it's been effective. Not 100% effective, but it definitely seems like it helps. So if someone gets really sick, and this is really for those who are going into intensive care unit, if they get really sick, then what we do is we actually can give them the remdesivir. We can also give them something called an interleukin inhibitor. So I mentioned earlier about this thing called a cytokine storm, where your body's just going crazy and trying to eliminate this virus, and fluid is going to all in these different areas. Well, we want to slow that down a little bit. So we can give a medication to do that. And that medication is an interleukin inhibitor. It's a cool name, a lot of neat science around it. I'm not going to go into a lot of that, but it ends up, but what it does is it really helps us to prevent you from hurting yourself, is basically what it does. The third thing, which is really important, and I got to tell you that I'm really happy at Griffin Hospital that we've actually started to do this, is that we can use something called convalescent plasma. So the IgG thing that I just told you about, well, I think it's important to know that once you develop IgGs, we can collect some of that. We could put it into a bag and use that as plasma. So we get the fluid level. So all those antibodies that you produced, we can, once you've been infected, we can take that back, and you can actually help support someone who's really sick, because we can take those antibodies and we can infuse them into someone who matches, and then we can give that to them and help them fight off the infection also. So it's really important, for those people who are listening, if you've had COVID-19, you had the infection, please look at the Red Cross website and see if you can be a donor to give plasma, so someone else can potentially do well or get better with this. We're looking at our data. It looks like this convalescent plasma is really going to work well. This is probably one of the best treatments that we have right now, but we really need people's help to do that. And I had to throw this in because this is a throw out for our Boston colleagues. You stay wicked far pot. So
that's excellent.
So that's what I have. I'm happy to answer any questions. I'm here, and for those who know me, my wife is also a pulmonary critical care doc. She's here. This is the two of our cars here. So we're at Griffin Hospital. We're here to support you. We're here to support the community, and we want to make sure that you know what's going on, and we want to make sure that we're safe as caregivers, and we're here to help our community.
Oh, that's wonderful. Thank you, Dr. Browne. And again, that's our guest, Dr. Fred Browne, Chief Medical Officer and Infectious Disease Specialist at Griffin Hospital. We are so fortunate to have someone with the skills like Dr. Browne right here in our community, right here in Derby. So thank you very much. Now, at this point, we're going to take questions from folks that have emailed question in. Some are sending questions in live. And we won't be able to get to all of the questions. But during this live virtual town hall meeting. However, we will respond to every question either by email, or perhaps I might even call you directly. But all right, so here we go. So the first question comes from Tom in Hamden. Tom asks, he wants to know if Dr. Browne, if someone tests positive for the antibody, does that mean they are immune? And if so, for how long?
That's a great question, Tom. So, you know what? Let me just put a little bit of an asterisk on this and say, there still needs to be more data out there to research this and make sure that it's clear. But based on basic virology and based on this virus and comparing it to other ones, you will be essentially immune once you've got this infection and have resolved from it. So you develop those IgG antibodies that I just talked about, and then you'll have them. And the beauty of it is that not only will you have them, but you will have them for life. And it's really interesting because, when we talk about the major respiratory illness, which is the flu, when we talk about the flu, when we had our last major pandemic, which was interesting enough, like 1918 was our last major pandemic, that we had found out that instead of older people getting sick and dying, it was actually younger people. The reason is because the older people had immunity to that flu at that time. So they had seen it, and then in turn, they weren't getting as ill as the younger people were. So that is sort of a truth in virology, and it's a truth in this, that once you get that, and again, it's a shout out for getting the vaccine for influenza, because it does have a cumulative effect. So it's really important to know that once you do have it, you have it. The difference, another caveat, the other caveat is that this virus will change. It's just because of its genetics code, it will change a little bit. So we don't know when we do have a vaccine how often you're going to need to get that vaccine. But right now, because people have, if you've got an infection, that right now you will not get this infection again.
Great. Thank you, Dr. Browne. Let's see here. Now I'm reading, I have one from Maria from Derby. And she asks, physician, nurse, and caregiver safety is another huge issue. Are they safe? And what other workplace challenges are you facing in terms of PPE, fatigue, depression, etc.?
I'll have to say that our hospital is, and our caregivers are fantastic. They're just wonderful, and they've done, they've gone into this wholeheartedly. We've been able to modify some of our areas in our hospital. Some areas, some of our outpatient centers really aren't getting a lot of volume, or weren't getting a lot of volume. And we've taken some of our workforce and consolidated them. So we're taking some of our nurses who are more outpatient, made them inpatient. We've put them in, and we've actually asked them to start taking care of patients within the hospital themselves. And they've done a really great job of doing that. So I think, I think it's hard work. I think it's really rewarding. We've had some good outcomes. People are getting better. I want, you listen to the news and you think everybody's dying. They're not. People are getting better, and the community has been fantastic supporting us. I think with the works with Senator Logan, helping us with PPE has been fantastic. I mean, the additional masks, gowns, goggles, everything that we've been getting from the community, and cloth masks. That's been extremely helpful. Making sure that we have the surgical masks for our caregivers has been really important. The N95s and the KN95s have also been really helpful for us to help with our staff. So our staff, again, I can't say that they're not tired. This is hard work, but it's rewarding when we have really good outcomes, and it's heartbreaking when it's not as positive as we want it to be. But it's sort of what we do. So that's a great question. One of the things that we are having a lot of problems with is in our supply, interesting enough, is swabbing. So we don't have a lot of swabs. That's been it's been an issue that's come up. So we want to test, and we think it's the right thing to do to test, but we've had some issues getting swabs and making sure that we can test people, as many people that want to be tested, or the people who are coming with symptoms. So we have had a shortage of swabs, and that's been sort of a major issue that we've had. And then there's been some small things. We've had to conserve on some of our PPE. We had to conserve on some of our medications, but nothing that's putting either our staff or our patients at risk.
Wow, thank you, Dr. Browne. And on that note, for example, I've been working with State Representative Themis Clairtis, State Representative Nicole Clairtis Ditria, Rosa Rabimbis out of Naugatuck, Dave Lavriola as well, in terms of helping to distribute donated PPE. And Dr. Browne will be coming to Griffin Hospital on Friday with 1,000 face masks that were donated by the New Haven Chinese Alliance Church. We also have been working with another organization called Masks for Heroes organization as well. So all these are nonprofits, and also just folks in the community who want to help donating personal protective equipment for our healthcare workers. So you'll see me. I'll be coming myself on Friday just to drop them off. I won't be going inside, but I'll have my face mask and I'll leave them out there for you. Now, let's see. I've got another question here from, let's take a Don from Bethany. So Don from Bethany, and this is one I've heard as well out there in the community. We hear that patients are no longer coming to the hospital when they are sick. Is it safe to go to the hospital? What steps have you taken to ensure the safety of non-COVID patients? That's an excellent question. Thanks, Don from Bethany. Appreciate that.
Thank you very much. So that's a great question, and this is a national concern, and I think there's been some great examples, or unfortunate examples, I should say, in New York and New York City, where people have been found in their homes who potentially have died of heart attacks because they haven't come to the hospital to be treated because they're afraid of getting COVID-19. It's important to realize that you need to take care of yourself. You need to make sure that make sure that if you have chest pain, if you have signs and symptoms of a stroke, if you have severe abdominal pain, you still need to come to the hospital. Please come to the hospital. We've had people who've come and it's been a little bit late, and that's going to lead, if we have good outcomes, sometimes they're not good. So if we have good outcomes, you could have a lot of complications later on. So that becomes really important. Let me tell you what's been going on at Griffin Hospital. So Griffin, very early on, we've actually been able to segregate certain areas of the hospital to make sure that they're protected for what we call an ILI, an influenza-like illness. So COVID-19 would fit in that, where they have people come in with symptoms. So if you go into our emergency department, we took a whole section, one of our pods, and we've actually modified that pod, and we made it so it's negative pressure. So George, what that is it modifies that entire area and makes all the air go outward.
Wow.
So it doesn't sit and it doesn't recycle. It actually goes out. So once you walk in there, there's actually negative pressure that's there. Each one of the individual rooms in that pod are also negative pressure. So what that means is each one of those rooms, as you go in there, is more negative than that center. So that means that person that's there is just getting that air. So it doesn't matter if you're COVID negative, COVID positive, or COVID presumed, or if you have something else like TB or some other illness, that room protects that patient and protects anybody who is actually going in there. It's going up and out. And as soon as it goes out, it's filtered, UV, and that's one of those areas. So if you're worried about coming to the emergency department, you know what? The emergency department, yes, everybody with our governor, everybody's still wearing masks and gloves and gowns because that's what we're supposed to be doing, but again, you're going to be safer in that area if you're COVID-19. If you're not going to necessarily be in that area. So again, just so people know that we have segregated it to take extra precaution in different areas. That's in our emergency department. On our floors, we've actually been able to do two things. We've been able to modify our intensive care unit. So within our intensive care, we've stepped up how we're doing personal protective equipment, and we make sure that we can manage each room individually and then figure out who's COVID positive, who's COVID negative, and how we segregate that and making sure that everybody is managing that appropriately. We've done something that I think is even better, is that we've actually modified an area that was out of service. It's a 21-bed unit, and that 21-bed unit, what we've done is we've actually modified each one of those rooms. Each one of those rooms is negative pressure and central negative pressure, just like the emergency department. So again, you don't need to stay in the emergency department if you have COVID-19. We have an entire unit that is dedicated for those who are actually COVID positive. So what will happen is that they will be managed if we need them to have telemetry monitoring, so monitor the heart. If we need to have them in general medicine or just observe them, we have a dedicated team of nurses who will be in their PPE, and they go from room to room with their PPE on, the same PPE, so they can conserve PPE, and everybody in that room has confirmed positive. So that laboratory confirmed positive. So that means we know that they're positive. No presumed, no possible, and no negatives. Everybody's there. So that's another way that we can protect our staff, because they're wearing the PPE. They're not walking into any unknowns. Everything is known. And our patients, because now they know they're in the same area, they're protected, they get optimal care all within that unit. So I got to tell you, we really took early steps. We're really proud of our CEO, Pat Schrammel, of helping guide us through this, making the modifications, our engineering department, even some of the community members who have actually helped us get that together before this hit has been excellent. And this is a unit that we will continue to use. So again, we have units that are COVID positive, and that allows us to have areas that are presumptive. So as we're ruling up people, and then we have what we would call clean units. So units that don't have any COVID or presumed COVID in it. So we have that opportunity to have every different section within the hospital to make sure that we're optimizing the care for patients, making sure we're protecting our patients and our staff, which becomes really important. It's an important thing for Griffin Hospital.
Well, that's super, Dr. Brown. And it sounds like, I think the message there is that Griffin Hospital, in this example, is taking extraordinary steps to keep your employees, our healthcare workers safe, and for those who need the other services of the hospital as well. It doesn't do you any good if you're not feeling well, if you have a major problem and you don't go to the hospital, because that could make your situation far worse, and it could be a matter of life and death. So if you're not feeling well, and if you need to get to the hospital, please do that, even if it's not flu or Corona-19 related. Now I've got another, let's see, I got another question here. Now this one, now here's a sort of breaking news for today, more breaking news. So it looks like, let's see, at least one news station is reporting that the state won't reopen until June 20th now. Previously I heard May 20th, and now it sounds like June 20th. And that they're looking at putting a plan together by May 20th, a plan for reopening the economy. So Dr. Brown, as it relates to healthcare and your area of expertise, our government now this question I'm about to read is coming from Lori in Naugatuck. Lori in Naugatuck says that our governors are talking about opening up their economies, right? Connecticut, other states, right, as well. Do you see obstacles that we need to overcome to do this successfully here in Connecticut?
You know what? And I think it's very doable. And I think it's going to take all of us together to figure it out. I think all of us, I speak for the healthcare workers, and I think everyone in the community having the education and knowledge of what's going on and understanding why we're doing what we're doing becomes really important. And that's going to help us to get our economies back, well, to jumpstart our economies, right? So what we're talking about is that we're talking about being hypervigilant about not spreading the virus to each other. So I think continuing to wear masks, I can't imagine that, businesses besides hospitals aren't going to have a mechanism to screen people as they go into work, and having the ability to screen them. And hopefully, things like thermometers are getting harder and harder to get. Hopefully we'll be able to have those resources like thermometers, like people who can do screening, continuing to have masks, making sure that everybody's aware of the hand hygiene. So having the supplies to do hand hygiene is all going to be really important. I think the most important thing, if you ask me, Senator, I think the most important thing is really probably going to be testing. I think once we realize the amount of people who are serologically positive, so they have the IgG, I think it's going to be better for our economy to know. So I think you're going to end up going, okay, well, I have, if I've had COVID-19 or had a mild case of COVID-19, and now I have the antibodies, that's actually great for us. That's great for our economy, because that means that I'm not going to catch it and I'm not going to spread it. And that's really important. The more of us who actually know if we have it, the better. And those who know that if we don't have it, that we need to take those precautions to prevent it from happening. So again, I think it's going to be a combination. I don't think the world as we knew it is going to be the same because of this. I think we've had a major change. This is going to be something different. This is something that we're going to deal with. And as people go back, if we're not careful, we may end up getting a spike. We may end up getting more people going to the hospital. So it's going to be really important for us to follow the same things that we're sort of learning how to do, not to lax on those, and making sure that we're washing our hands, wearing masks, and then hopefully we can all bring our economies back. It's interesting too, doing stuff like this, Senator Logan, I think is really important, because this allows us to socialize more. And humans aren't designed not to socialize. That's right. So we need to have these connections. And sometimes I feel bad for those who are, really are at home and really don't have a lot there and don't have the technology that we have to engage. So make sure that you're calling your loved ones. Make sure you're spending, at least call them and connect with the elderly who really are the high risk, but make sure you're talking to them and making plans for the future and keeping them active and involved. There's a lot of risk about this type of social isolation for people who have mental health problems. people who have addiction problems, and then who are elderly or have mild or developing dementia. So keep them in mind, and let's continue to get ways that we can keep them stimulated or out of trouble.
That's great. And again, we're with Dr. Browne from Griffin Hospital. Now, Dr. Browne, I've got another question here. This one sort of leads right into from where you just left off. Andy from, I believe, Woodbridge. This one's a bit long here, Dr. Browne, but it's a good one. Let's see. He says, Andy says, my wife and I have been taking care of our friend who has renal disease and on dialysis. She came down with COVID-19, spent a week in the hospital, but not on a ventilator. She's back home with a live aid. When can my wife and I safely be around her in her house? Should she and can she get retested?
That's a great question, Andy. A great question. So let me talk to you about what CDC recommends and what sort of makes sense. So this can be a little bit complex. So I'm going to give you sort of the complex version, and then I'll give you the easy version. So the complex version is the CDC allows people, in particular healthcare workers like myself, if I was to contract COVID-19, right, the day that my symptoms begin, right, that we call that day one. 7 days after those symptoms is the days that I'm no longer infectious, only if I haven't had a fever for 3 days and my symptoms are improving, right? So that's what it says. So that they would allow me to go back to work, or they're recommending that it's okay for me as a healthcare worker to go back to work as long as I wear a mask. And remember, we're all wearing masks anyways. There's nobody else in this room. That's why I'm not wearing a mask. So we're all wearing masks anyways. And I'm supposed to wear a mask for 14 days. So the easy answer is 14 days. As long as the symptoms, as long as it's been a period of 14 days, that's the safest way to go. So as long as it's been a period of 14 days from the initiation of her symptoms, then you should be fine. If you feel or you need it to be more urgent, that 7-day window is okay. You just need to be careful. And when you're careful is that when we talk about careful, she should wear a mask and you should also wear a mask, and be careful to wash your hands. And that becomes really important. Contaminated surfaces are an issue. But I'm glad she's doing well. I'm glad she came out of the hospital, and that's really good. And again, if you get past that danger area, and now she's immune, which is great and good for her. Senator Logan, you're muted.
Thank you for that, Dr. Browne. So, all right. So we are running towards the end here of our time, and thank you again for your time. We got a couple more questions here. Maybe we can come up with some quick answers here. But
sure, I could do quick.
All right. How long? Or let me see. Who does this come from? It says the question is, how long do you think this pandemic will last in the United States? And this is coming from Chris from Woodbridge.
So Chris, great question. So nobody really knows.
Oh boy. Hey, you're giving it to us straight. I like that, Dr. Browne. Don't sugarcoat it. It is what it is.
I can tell you what it is probably we're all going to go through a spike. And then once we get to that spike, it's not going to get to that level again. I'm hoping that the valley may have already gone through its spike. We'll see. Nobody really knows when a spike occurs until after it happens. There's still some wild cards, I like to say. So areas that can still occur where you can get a lot of people who potentially get sick, but we've been doing a lot of managing in those areas. So we'll see how Bridgeport and New Haven do. They seem to be getting close to their spike also. But it seems to be going a sort of a up 95 corridor. So it goes through us and then it continues to move forward. I can say, like I said before, that this is not necessarily going to go away. This is going to be with us. And we're going to see these spikes that occur, not as high, but we'll continue to see these spikes. And this is probably going to continue until we get a vaccine. So that could be almost a year. Now, granted, it's going to occur. It's really going to occur when things happen. And the more of us who are immune, the better. Because that means that if all of us are immune, it's a lot harder for someone who's not immune to get infected. And they use that, they call that term, Senator Logan, they call that herd immunity. So the more people in the herd that actually are immune, that means the less likely the people who are not immune are going to get infected.
No, certainly I've heard that thrown about quite a bit. So thank you for that explanation. Let's see. The next question I have, let's see, it's a group text here. Ooh, it's Hunter and Tracy. And it looks like those are my kids here. They have a question here. I gotta see. Let's see what the young folks have to say here. Let's see. Dr. Brown, they want to know how long might you estimate before normal travel might be safe again? Yeah, they want to, they're getting stir crazy. They want to go see their friends. Normal travel. How long do you think we'll be back to normal travel conditions again?
So you know what, it's interesting because we say, normal travel, I don't know if it'll ever be necessarily normal, but you know what, I don't really foresee that it's going to be that much longer. It really depends what other areas get hit within the United States. But as you looked at this, it sort of started on the West Coast and sort of headed to the East Coast. I think it hopped over some of the states in there. So you just got to be careful about those states. I think we're getting closer and closer to traveling again, which is great because I think people want to get away. So I'm hoping in the next months or so, probably the summer, I think people are going to start traveling again. And I think just like we're going to do with opening businesses, I think what we're going to need to do is we're going to need to use extra precaution, making sure that we're washing our hands, plus or minus masks, and just being extra careful. But you know what, we gotta get back and get some of our colleagues in the entertainment business back in business.
Yeah, I hear you. I hear you. All right, let's see. I've got another question here from Sarah. Doesn't indicate where she's from, but Sarah, she says, my son had mono and became very sick with the cough and fever for 5 days, felt better for a few days. Then it came back for 48 hours with 103.5 fever and was having trouble catching his breath. Tested negative for flu. Is it possible that he had coronavirus? And can he be tested? That's the
So
question.
Depends when it occurred. So if he had mono and then he ended up having a flu-like illness or an influenza-like illness, then depending on when it occurred. So we really didn't see this until in this area, I would say mid-March. Anything before mid-March, it may have been something else. It could have been the mono. It could have been another viral illness. It's really difficult to say. Ultimately, eventually, everybody will be able to be tested. And what I would recommend is that you might want, if he's well now, great. What I would recommend is in the future, probably in the next couple of weeks, go ahead and get some serology testing. And your primary care doctor can do that for you. So you can just check to see if he has an IgG and IgM, and then you'll know.
That's super. Thank you, Dr. Brown. And again, I want to thank you for joining us, Dr. Brown. I'm going to wrap up now, if that's okay with you, Dr. Brown.
Absolutely. Thank you.
Thank you very much.
No, great questions.
Much appreciated. We have some excellent questions here today, and we'll keep this post up so folks can refer back to it at their own leisure. Before I sign off, I just want to make sure, because our seniors are so important, I want to provide a little bit more in terms of senior information and advice. First, be sure to talk to older family members about medication and supplies, food, home care, and backup plans if the virus threat is longer than anticipated. Let's remember our seniors. Remember that social distancing does not mean social isolation. Never underestimate the power of a phone call, a video chat, social media, or even old-fashioned snail mail. It's important to call our loved ones to make sure they have everything they need and are doing well. A call to just say hello can do much to lift someone's spirits in challenging times. The Centers for Disease Control and Prevention is also recommending that communities create the buddy systems to make sure vulnerable and hard to reach people are connected. This can be done through email or by scheduling virtual family time with older loved ones. Let's remember our seniors. In my own family, I've got my mother. She is 82 years old, and I'm doing everything I can to help her out with getting her medication and bringing her groceries. When I do go there, I go in there with a face mask. I'm putting those groceries on her table because I'm out and about so much. I don't spend a lot of time inside her home. I put the groceries down, and my mom and I are doing video chat and chatting outside of that. I also have my mother-in-law, Jean Simmons. She lives in my same town in Ansonia, and we try to do everything we can to make sure that she's doing as well as she can. She's also has a compromised immune system. She is herself battling the early stages of breast cancer. So we are dealing with that as well, and being extra super careful to make sure that she stays safe. So I want to thank, before I go, first responders again, police, fire, EMS, our healthcare workers, grocery workers, all the other service workers that have to get up and get out there every day, and all those essential workers. And I want to thank you for giving me your time today. It really means a lot to me. I am confident that our community will continue to work together. We will do our part to stay at home as much as possible. But when we're out in the public, let's practice appropriate social distancing and use PPE. I love our state, and I love to see everyone in our beloved state of Connecticut safe, healthy, and prosperous. So again, thanks again, Dr. Browne. Thank you all for tuning in and listening, and look forward to communicating more and getting more information out on my website, on my social media. And we are going to get through this, and let's just keep working together and get it done. Thank you.
Thank you.